This episode is brought to you by my 10-week Fertility Awareness Mastery Group program. If you're listening in real time, registration for my January 2018 groups is now open. To reserve your spot today, make sure to head over to fertilityfriday.com/group program. That's fertilityfriday.com/group program. This is the Fertility Friday podcast, episode number 167. Welcome to the 167th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I'm thrilled to share today's episode with you. If you had an opportunity to listen to our episode earlier this week, so if you're listening in real time, last week's episode I released on Wednesday, and so today, Friday, I'm releasing a second episode, and it's kind of like a mini series because in last week's episode I had Rebecca Coombs on the show, and we were talking about SIBO and the relationship between small intestinal bacterial overgrowth and gut health and IBS, irritable bowel syndrome, and also the connection between SIBO and fertility challenges. And so that was a great episode. And if you haven't had a chance to listen to that one, I'd encourage you to listen to that one and this one together. So in this episode, I'm actually interviewing Dr. Allison Siebecker. And Dr. Siebecker is an expert in the area of SIBO, small intestinal bacterial overgrowth. And I was really excited to have her on the show to really delve into SIBO. This interview is jam-packed with a lot of amazing information about SIBO and about the processes, the causes, the symptoms, how you know if you have it, what's the deal with testing, how do you get tested, and how do you treat, what should you do? And so she provides a wealth of information. And, you know, together with last week's episode, I feel like you're getting a lot of great information about this really common condition, but lesser known. It's not as well known as some of the other, it's not as well known as IBS. And even as we talked about in the previous episode, many practitioners aren't necessarily testing for it because it's just not as well known yet. I've talked about on the show a number of times the connection between gut health and fertility. And what's interesting is that if you do have challenges with gut health, challenges with food sensitivities, or different gut-related issues, they often show up on your chart in a number of different ways. And so I've supported a number of clients who are dealing with gut issues. And again, we use the menstrual cycle as a way to monitor their progress, to kind of see what's happening and to gauge the effectiveness of anything that they're trying in their quest to improve their cycle health and fertility. And so for more information about fertility awareness charting, I have a number of programs. If you head over to fertilityfriday.com/work-with-me, you'll see all the programs that I offer. I offer a group program. Registration is now open for my 10-week Fertility Awareness Mastery group program. And so that's a program that I only offer a couple of times a year. And where starting in January, registration is open now during the month of November and December if you're listening in real time. And so I would invite you to head over to fertilityfriday.com/group program if you're interested in the 10-week group program. And so again, that's fertilityfriday.com/group program. And if you're not listening in real time, if you're listening to this episode later on, you can always head over to that page and find out when the next group program is going to be offered, or just to get on the wait list. So if you're not listening in real time. And without further ado, let's jump into today's episode. And I'm really excited to be here today with my guest, Dr. Allison Siebecker. She's worked in the nutritional field since 1988 and is a 2005 graduate of the National University of Natural Medicine, where she earned her doctorate in Naturopathic Medicine and her master's in Oriental Medicine. She was the co-founder and former director of the SIBO Center for Digestive Health, and she's specialized in the treatment of SIBO since 2010. I'm really excited to have Dr. Siebecker on the show today because in today's episode, we're going to be focusing on SIBO and the effect that it can have on your health. And so without further ado, welcome to the show, Dr. Siebecker.
Thank you so much for having me.
Well, thank you so much for being here. I'm thrilled to have you on the show, and I'm so excited to pick your brain about all things SIBO. But before we jump into the interview, though, I always ask my guests how they ended up in the fields that they're in, and I'd be really curious to find out what was it that catapulted you into SIBO in particular?
It's such a standard classic story. It's because I have it. So I've had what I knew to be IBS since I was about 5. I wasn't born with it. from the stories I can tell from my family and my mom, I had well-functioning digestion until I was around 5. And then something happened, which I think I now know what it is. And so then I struggled my whole life, and I've had bloating and pain. I have the constipation type of IBS or SIBO. And so I was always struggling with it and the symptoms and all the things that go with that. So, I'm a person that has the disease or disorder. I'm a person also that, therefore, because I'm almost 50, so then that means that I'm a chronic disease person. I've had it my whole life. Anyway, when I went to medical school, I couldn't find very good answers for IBS. We've gotten a lot better answers since I've been out of school, but I was just so frustrated. And then eventually when I found this information out, I just felt so on fire to share it, really. So that's been my whole mission, is to educate doctors, to educate patients on this information that I consider to be missing in my normal patient life and then in my doctor life. So we were all missing it. And so if I could just spread the word, that's been my mission, is really just to share information, raise awareness, and then more people could hopefully be helped. And it's not like we have all the answers, because it is a somewhat newer field, but the answers that we do have still offer way more help than what was available when you didn't have that knowledge.
Well, and I'll let you decide if you want to talk more about this, but I'm curious about how discovering SIBO made a difference for you in your life. Obviously, for years struggling with IBS symptoms, how did that shift things for you?
You mean like in terms of my actual symptoms and health?
Yeah.
Oh, yeah. Well, the first thing that I found out about was one of the diets that's used to treat SIBO, which is called the specific carbohydrate diet. And I've since figured out, and my colleagues as well, that isn't I think it's not the best suited diet, but it's really good for this condition. And so I put myself on the diet, and it was within 24 hours, my pain was gone. And it's never come back to the level it was back then. I mean, it was really bad. I was, being woken up in the middle of the night, most nights. It was ruining my life. And so, gosh, within one day, 24 hours, to have your pain be gone, unbelievable. And of course, that just warmed my naturopathic heart that it was diet that did that, instead of a drug per se. But so that was the first thing. And then moving through the antimicrobial treatments, my digestive situation, my symptoms have just gotten better over time. I do have a chronic case, so they're not gone. But learning this information, what it did was really allow me to get my life back, so to speak. Obviously, I was living my life. Obviously, I went through medical school, doctor school. So you would think I wasn't too bad off, but it's amazing how bad off people can be and still do amazing things, But anyway, that's what it did for me and for my health. It's just really take the symptoms down and really help with the disorder. I would say it brought it down to a sort of a 25%, 30% level, which is very manageable. I can live a happy life. I do still follow sort of a special diet, but I don't find it impairs me too much. It's still not so hard to eat out, and I've always liked to make my own food, so that helps. So, and it just gave me my energy. And so anyway, it was a turnaround, a massive turnaround. And I think, you'd have to expect that it, obviously I got so much better. That's what could give me the fire. Like, otherwise, if it didn't really work, I wouldn't be wanting to share the information, right? But it really helped. And it helped most everyone that I've taught it to. So, yeah.
Well, thank you for sharing that. I find that it's really powerful to hear the stories of transformation. And I also find it particularly interesting just to find how everyone gets into their field. As you can imagine, just by doing these interviews, I get to talk to a lot of really amazing people like yourself. And it's really inspiring just to see how often adversities in your own life have propelled you into doing this work so that others don't have to go through as much suffering as you did.
That's exactly it. And, and I worked in a health food field, health food store. I worked in the aisles of a health food store on the vitamin section for years before I went to medical school. So I also have a real love of sharing information. Doctors and people in the medical field often are like not wanting to share free information because they think you should go to your doctor. But I know what it's like from the other side when you're searching for information and the doctors don't have it. So I've really tried to balance that out when, like you say, when you go through something and you just want to try and spare someone else something that you went through. So that has been the big thing. And that's why I'm always just trying to give information, and I just give so much for free, and lots of other people do too. And I'm so glad that the world is like that, you know?
Yeah, no, it's so necessary. Well, let's dig into SIBO. A great place to start is, what is SIBO? How is it defined?
Okay, so it is, like the name sounds, it's bacteria that is overgrown in the small intestine. And in the digestive tract, we have, in order of top to bottom, we have, the mouth and the esophagus, then the stomach, then comes the small intestine, and then the large intestine. So a lot of times people don't really think about the difference between the small and large intestine if you're not, a doctor. It's just like whatever, the intestines. But they are different in what they do, their function, and even how they look. So the small intestine is where our food gets broken down, digested, and absorbed. And it's not supposed to have a lot of bacteria there because they would interfere with that process if they were there. And that is what they do when we have SIBO. So the small intestine has much smaller amounts of bacteria. The large intestine is where people, we think about how we have a lot of good bacteria and we're supposed to have bacteria in our intestines. That's true, but that's for the large intestine. So what happens is something gets disordered, something goes wrong, allowing bacteria to accumulate in the small intestine. They could accumulate because bacteria are always coming down from the top, like we're swallowing them with our food, and just as we swallow, and even as we breathe, they're always coming in and through us, down through us and down and out. And then some of them stay in the large intestine. So the ones from the top are then able to accumulate, not pass downward. The ones from the bottom in the large intestine, they might go backward and come into the small intestine. One way or the other, it's not supposed to happen. So, technically that's what it is. It's just too many bacteria. And these are, by the way, these are normal bacteria. As you can tell from my description, they're the bacteria that would normally be in us. They're just in the wrong place.
And so for the listeners, just to make sure, so SIBO stands for small intestinal bacterial overgrowth. So it sounds as though we're not supposed to have a whole bunch of bacteria in the small intestine, but in this case, there's a growth of it in there, and that's causing a bunch of problems. So why is it a problem for us to have bacteria then in the small intestine? What happens? What
happens is they wind up basically eating our food. And so the medical term for that would be, or whatever the technical term would be, fermentation. So because bacteria, when they eat, it's called fermentation. Same thing with yeast. So they consume our food, and then their end product, what their poop would be, so to speak, is gas. So they output this gas in our intestines, and that gas can cause problems. It can cause all the symptoms that we think of, which we haven't gone over yet, but I'll just say them now. We think of with IBS and SIBO. So bloating, swelling up like a balloon from gas expanding there, and pain, because the intestines are sensitive to pressure. So a gas swelling is like a pressure. There's some other reasons that it can trigger pain as well. But one of the more interesting things is that the types of gas that bacteria make, and specifically here it would be hydrogen and methane gas, and also hydrogen sulfide, but specifically the hydrogen and the methane gas, they make that gas and humans don't. We don't make those two gases. Anyway, when they make those gases in our intestines, they can interact with the nervous system of the intestines and cause constipation or diarrhea. So they can actually cause bowel movement irregularities. And not everybody knows that these gases can do that. They can also put a backward pressure upward on the system, causing acid to reflux. So, heartburn and acid reflux. They can make a person feel nauseous from that sort of backward pressure. And they can cause most of the other symptoms too. But one of the key ones here then is that we're talking about bacteria eating our food and making gas, and then the gas can trigger symptoms. So what that really all means is that you get symptoms after eating. So it basically food sensitivities or food reactions. That is probably one of the hallmarks of SIBO, along with maybe the bloating. And now that's all describing when the bacteria make gas and how the gas can make symptoms. But there's something else that they do too. They, by being in the small intestine, they actually damage the lining of the small intestine, because that organ is just not prepared to have a lot of bacteria there, because we're not designed for that. So that doesn't happen when there's a lot of bacteria down in the large intestine normally, but it happens when they're up there in the small intestine. So they can create inflammation that can lead to leaky gut. It can also mean that the enzymes we normally have sitting along the lining of our small intestine are sort of disintegrated or gotten rid of by the bacteria. So now we don't have enzymes we would normally need to digest our food. And also part of the damage they can do to the lining is we have to absorb, the nutrients across the lining into our body from the inside of the intestines to the innermost part of our body. And they can damage those transporters. There's sort of like shuttle buses that transport the nutrients across into our bloodstream and things like that. And they damage those. So just to summarize, the two things I'm really saying here are why it causes problems is because the bacteria eat our food and make gas, and the gas causes symptoms. And number two is the bacteria damage the lining, which then decrease our normal functioning.
It just paints a very interesting picture. It's one of the questions that automatically comes up in my mind is, could you share with us the connection between SIBO and IBS? And, if someone has SIBO, does that mean, like, if someone has IBS, does it mean they have SIBO, or how are these two related?
Yeah, sure. So IBS is a syndrome that's diagnosed or identified by symptoms. And the symptoms that most of us think are IBS are bloating, abdominal bloating, abdominal pain, constipation, diarrhea, or a mixture of the two. Now, that actual definition that I just gave doesn't fit with what the highest authorities in the medical world say, because they've been changing what symptoms they say are IBS. But the reason I'm saying it the way I'm saying it is because that's what most physicians and doctors agree upon, is the definition I just gave. So basically, not all doctors agree with how the definition has changed. Anyway, basically, if you're just diagnosing a syndrome by those symptoms I just said, it means it could be IBS. You can call someone as having IBS, and they really could have like 40 other things, actually, because those symptoms, bloating, constipation or diarrhea or mixture, and pain can be caused by about 40 other things. And we call that the differential diagnosis, meaning what else could be causing this? So IBS is a little odd because basically you're said to have it when you've looked at all those other 40 things and you don't have any of them. And so then you're just left with these symptoms that you can't find a cause for. So then you call it IBS. That's basically the deal with IBS. And it's why everyone's so frustrated by it, patients and doctors alike, because it's like, what does it really mean? It just means, I don't know. It's like, what happens for a lot of people is they haven't had those 40 other things ruled out. They haven't had anything else ruled out. They just are told they have IBS because they have those symptoms. So that's a problem. Well, anyway, what has been figured out is one of those 40 things, and I'm just saying 40, I haven't exactly counted, I'm just on average here, somewhere in that vicinity. One of those things is SIBO. So SIBO could be the cause of those IBS symptoms. And then in that case, you could be said to have both IBS and SIBO, because you can be said to have IBS if you have those symptoms. So, but really in that case, we're going to care more about the SIBO because that's what the real cause is. So that's really how they're related, is that SIBO can cause IBS. Is it possible for somebody to have SIBO and not have IBS? Technically it is, because you can have the test for SIBO and be shown to have an overgrowth, but you don't actually have that conglomeration of symptoms. Maybe you don't have any. There is such a thing as a sort of asymptomatic SIBO, asymptomatic in the digestive realm. And what happens in those cases, this is a little trickier, but in those cases, they usually have an associated disease. There are a lot of associated diseases that go along with SIBO. So I'll just give an example, like rosacea. Used to be called acne rosacea. It's a rash sort of circumstance of the face. And so sometimes people have that condition and they don't have digestive symptoms. And then they're, upon investigation found out to have SIBO, and then they treat the SIBO and the rosacea gets better. So you can have SIBO without having IBS, and you can have IBS without having SIBO because maybe your IBS was caused by something else. For instance, lactose malabsorption, or on the other end of the severity spectrum, pancreatic cancer. Both of those things can cause the exact same symptoms as SIBO. So you can see how you have a lot of things here on the DDX, as we call it, the differential diagnosis. So hopefully that explains it.
Mm-hmm. Well, it's very interesting. So IBS, irritable bowel syndrome, just in case anyone was listening and is like, what the heck are they talking about?
all these
All these
acronyms.
Yeah, with the acronyms. But it's interesting because then IBS is kind of a diagnosis of symptoms without really knowing where they come from. So yes, that's super annoying because often in cases like that, there's kind of very little we can do about it because we don't know why it's like that's kind of the standard line that a patient would be getting. And it's really interesting to see how these things are related, how a person could have SIBO and that could be causing the effects, how a person could have SIBO and not have any effects. I think it's very interesting how the same condition can play out differently in different people. What would you say would be so we went through the symptoms, so I have an idea of what that looks like. But for anyone listening who tuned into the episode because maybe they think they might have SIBO or because maybe they were just diagnosed with SIBO and they're wanting to find more information about it, what would you say are some of the most common side effects? Like are there any telltale, or is it always just like, I'm not sure how you would take that question, but are there any telltale side effects that a person could look for?
Yeah, you mean like symptoms type of thing?
Yeah, sorry, symptoms.
Yeah. Really, probably the most common, the two most common are bloating, abdominal bloating, which is also called distension, and food reactions. And by food reactions, I more so mean digestive symptoms coming after eating or associated with eating. Now, not everybody links that because sometimes the symptoms come maybe 2 or 3 hours later. In fact, that's very common. They come about 2 or 3 hours later. And if you're busy, you're on to something else. You don't think back that it was maybe your meal that caused it, your last meal. But I would say those are the two most common symptoms. And then just the general picture of IBS. So some discomfort or pain, it could be low level, could just be discomfort or pain in the abdomen. We already said the bloating and the food reactions, and then, a tendency to constipation, diarrhea, or some sort of mixture of the two. If you have those, it's very likely that not very likely that you have SIBO. Well, I'll tell you how likely it is. It's about 60%. 60% of people who have IBS, it's been shown that SIBO is the cause. So it is very likely that SIBO could be there. But I do want to mention just a few other symptoms and signs. Those are the most common. But fatigue. Now, fatigue could be caused by absolutely anything. But it's very common in SIBO because those symptoms I just mentioned are quite exhausting. And also, it is an overgrowth of bacteria. And these bacteria, they're not pathogenic, but still they have their damaging effects. And that's tiring on our body. But also, anxiety and depression, more so anxiety. So this is an interesting one. How many people would think, I have anxiety. Oh, maybe it's SIBO. Like no one's thinking that,
No.
But it is a significant cause of anxiety and the type of anxiety that's reversible. So it's not personality based. It is based on a health condition. So I wanted to mention that. And also acid reflux, which is so common in our society. SIBO can cause that. So these are some things to think about. And then some signs would be if there's fat in the stools, so they float and look fatty. That's one sign. And a lot of times people with SIBO will start to become underweight. And usually this has to do with the fact that they're reacting to so many foods that they eat that they're maybe without fully knowing it, they're eating less, they're having smaller portions, they're cutting foods and meals out. So that can happen. There's other reasons for becoming underweight in SIBO, but that's another sort of sign. It's like you're starting to lose weight, you're decreasing your portions. And another thing is actually anemia or its precursor, which is low ferritin, chronic low ferritin. This is linked with SIBO. So I just wanted to mention some of those signs that if you have those and you don't know why, you could think of SIBO.
Well, and as you were sharing those effects, what came to mind was maybe you could share a little bit about how these bacteria, and I think you touched on it a little bit, but more specifically, how these bacteria, this overgrowth can impair nutrient absorption. So how it can actually affect how much nutrients we are getting from our food.
Well, it's back to those two things that we were talking about before. First off, they eat our food, so they directly steal it. So bam, there we go. They're getting it, and we're not getting all of it because they're getting some of it, and then maybe we're getting some of it, obviously. because otherwise it would be in real bad shape if we weren't getting any of it. And then the second thing is that damage. So they take away the enzymes on our lining that we need to break apart the nutrients so that we can then absorb them. And then they actually damage the transporters of those nutrients into our body. So straight up inhibit nutrient absorption with SIBO. So that's another way we can start to become underweight. That, I didn't mention that one, but that's another way.
Well, and is it kind of across the board, like all nutrients, or are there particular nutrients that are more likely a person more likely to develop a deficiency of?
Well, the number one thing that bacteria likes to eat is carbohydrates. That's what they're actually fermenting, turning into gas. And carbohydrates is one of the 3 macronutrients. So there's protein, fat, and carbohydrates. And so carbohydrates, pretty much, if you have SIBO, you have carbohydrate malabsorption. That is part and parcel of the situation. Mm-hmm. And carbohydrate foods, just so we get a sense of it, are like everything that we love. So we know about the sweets and the treats. That's carbohydrates. So grains, which get then made into breads and cookies and all those things. But it also includes all vegetables. Vegetables are carbohydrates. All fruit is carbohydrates. So a lot of times people say carbs and they think sweet foods, but no, vegetables and fruit. Fruit is sweet, but and then beans and nuts and seeds. Those are all carbohydrates. And then, of course, there's sugars we add to things, but there's also the sugar in dairy, like lactose. And there are carbohydrates in the skin and bones and joints of animals. So, for instance, if we make bone broth, we'll have carbohydrates in that. That's, the most prized bone broths are made that have from a lot of cartilage that have a lot of carbohydrate. And like foods like ribs, slow cooked ribs or something that have a lot of cartilage, there's going to be quite a bit of carbohydrates. I like to mention that because sometimes people will have a light bulb go off like, oh yeah, I have had problems with bone broth, or I have had problems with, rib crockpot dinners or something. That stands out to me, or oftentimes bacon will bother people. So, so that because normally you might be thinking, oh, it's just breads, but it's all these foods. So anyway, that's the first category would be of what nutrients would be carbohydrates. But second, specific micronutrients would be iron. We do seem to have a problem with iron. So that's where the anemia and low ferritin come in. And also B12 can be affected. So that's a different type of anemia. Folic acid is usually not affected. It's not low because the bacteria make it in the small intestine. But then some of the minerals as well, like magnesium and zinc. Well, I did mention iron already. And then all of the fat-soluble vitamins. So that's vitamin A, E, D, and K. All of those could be affected because I didn't mention this yet, but bacteria, one of the things they do that causes damage in the small intestine is they deconjugate bile. And bile is something we need to digest and absorb our fat, specifically to absorb our fat that comes in our foods and our nutrients. Well, fat-soluble vitamins, they're fat. So they need bile to be absorbed properly. And when bile is deconjugated by bacteria, it's not in the proper form to help that absorption. So that's one of the ways in which we could be low in those vitamins. So, vitamin D deficiency is famous now, and people are very well aware of it. And obviously it can come from things like not enough sunlight or being inside all the time. But this would be another contributor, could be another contributor.
Yeah, that's really interesting. I know when you mentioned that one of the side effects was anxiety, in some ways it isn't surprising, but then in other ways it's kind of, you would never think that a bacterial overgrowth in your gut would contribute to anxiety. Maybe you would, but I feel like it wouldn't be the first thing that came to mind. And I wondered if it could have anything to do with that nutrient malabsorption or if it has a different type of process. I'm not sure if you want to speak to that.
Oh, sure. Yeah, it does. They've taken a look into that. And what it has to do with is the cell wall of gram-negative bacteria is called endotoxin, and it's also called LPS for short, lipopolysaccharide. And so anyway, the point is the cell wall of many bacteria is identified and recognized by our immune system so that we can say, oh, there's a foreign invader type of situation. And what our immune system will do is create cytokines, and these are sort of messengers. And there are some that are inflammatory, and there are some that are non-inflammatory. And anyway, when we have an overgrowth of these bacteria, we have therefore excessive amounts of these endotoxins, and our immune system reacts, and we can make extra amounts of inflammatory cytokines. And they have specific ways that they trigger mood changes in the brain. So this has all been studied and laid out in a lot of research. Many people know about this and have talked about this. So LPS or endotoxin can trigger anxiety and depression basically through the inflammatory cytokines.
It's so interesting. So in our pre-chat before we started our call today, one of the things I mentioned to you was what I see from my vantage point as a fertility awareness educator. And I mentioned to you, I can't look at someone's chart and say, okay, you have this. That's just not how this works. But often you can see when, I've worked with a number of women that have various challenges, whether it's with digestion, IBS, SIBO also. And when I work with women that have these challenges, it shows up in some way on their chart. And it's so interesting to hear just the different ways that these bacteria are kind of messing up your system, whether it's inflammation or nutrient malabsorption. It's just so fascinating. So one of the examples that I shared with you is that many women who I've worked with who have some sort of gut challenge happening, when they're charting their cycles, they'll notice abnormal cervical mucus patterns. And so once they get that sorted out or stop eating the food that is causing the problem or whatever the situation for that particular person, then you'll often see quite a shift in their mucus patterns. So it's just interesting how these things are all related. So I'm really fascinated to hear how these little bacteria can cause such havoc in your body.
I know. And especially when they're not causing havoc when they're down in the large intestine, and I think that's just because that room or that chamber, that container is built to house them, so when they go into a place that doesn't have the right, I don't know, paint on the walls or something, it doesn't work out so well, it's like, so, because we have such an emphasis on good and bad bacteria. And I think that's just a little too simplified. It's in this case, they're good in the large intestine, but they're not good in the small intestine. Mm-hmm. But anyway, thank you so much for bringing that up. It's so important that because you can see from your work something's amiss, and a lot of times you don't know what it is, but you get it sorted out, and then bam.
Yeah, makes such a big difference. And you said something really interesting in our pre-chat, which is alluding to what could be causing this. So I'd love to hear you talk a little bit about what it is that causes it. Why is it that these bacteria are where they're not supposed to be? So in a person that doesn't have SIBO, why don't they have SIBO? What's the difference?
Okay, so I think it's kind of somewhat easy to understand if you think about it, that we have protections or sort of normal functions that act as protections against bacterial overgrowth in the small intestine. Normally, that's part of how we're made. And so that would mean that one or more of those protections would need to stop working. They'd need to fail for somebody to then get SIBO. It's not normal to have SIBO. So something has gone amiss a little bit. And what the natural protections are things like hydrochloric acid in the stomach. So our normal stomach acid, because the acid kills a lot of incoming bacteria. And then we have the bile I was mentioning before. Bile is secreted into our small intestine to help with our fat digestion and absorption. Well, bile controls the growth of bacteria and then even kills some of them. And so that's another way that we sort of control those numbers. And then enzymes actually can kill and digest and sort of break apart bacteria. And we secrete enzymes into our small intestine and also have them on the lining. So that's another way that we sort of control the bacteria in the small intestine. And then we have sort of like our normal anatomy. So one of the features of our anatomy is down at the bottom of the small intestine. There's a valve, the ileocecal valve. You can kind of think of it like a sphincter, like it's basically closed normally, and then it opens to allow things to pass through when it needs to. So what if somebody had theirs surgically removed, which, a lot of people do because they might have had some other circumstance occur, another bowel disease or something. So if they don't have that valve, or if it's not functioning well and it's sort of stuck open, well, that might allow for some of the bacteria to move backward from the large intestine up into the small intestine. But there's another sort of aspect of our anatomy is just to think about the normal way the tube is, the one tube going into the other. It's a tube that things can pass through. So we just need to make sure there's nothing compressing it or twisting it or kinking it, basically sort of obstructing it. I would probably say that's probably the second most common way people seem to get SIBO is something's obstructing their small intestine, so there's not a passage through going well. And then the last and probably the very most important protection is the migrating motor complex. And this is a form of motility, or I guess you could think of it like a form of peristalsis, a form of movement that occurs in our small intestine when we're not eating. So it's like a cleanup. It's called the housekeeper wave. Once you're done eating and sort of digesting and absorbing your food, this motility cleansing wave comes through our small intestine to sort of move everything, any debris out, like wash up afterwards, clean it up and move anything out. And that moves whatever's there, including bacteria, down into the large intestine. So, and we think that that is the most important protection because, for instance, even if you were missing your ileocecal valve, so long as you had the migrating motor complex working, it's providing this downward current. So even if you had an opening where bacteria could come up, they'd be pushed back down. So now I've said what these protections are, but to translate that into, well, what happens to make these things fail or go wrong? The main categories would be there are many diseases that can, make those things fail. And there's also drugs that can do that, or lifestyle factors, and also surgery or injuries, and even genetics. So let me just describe a few of these. I'll pull a few out. I talked about the obstruction. So, for instance, there could be diseases like where there's a tumor formation, where it's pushing on the small intestine, somewhere in the abdomen, pushing on the small intestine and making it so nothing can get through. Or what if somebody had endometriosis? That causes a lot of inflammation and scarring. And those scars, which are called adhesions in the intestines, they can twist around and compress and occlude the small intestine, basically obstruct it. Or an injury could do that too. Adhesions also come from surgery. So these are some of the things that could create adhesions or obstructions. Now, let's go back over to the motility one. Probably the most common cause for most people's SIBO in general would be food poisoning. And food poisoning is also called traveler's diarrhea, stomach flu, or I'm missing one. Traveler's diarrhea, stomach flu, food poisoning. I'm missing one. Oh, I know. It's acute gastroenteritis is the medical term. So anyway, I can describe this in detail later if you want, but it's been figured out that what this can do is stop that migrating motor complex. Maybe not stop it completely, but really decrease it. And there are other things that do that, like diabetes can slow that wave. Hypothyroidism, which is very common, is known to be associated with constipation, and it also, so it could slow that motility, but it could also slow this motility. And SIBO is very correlated with hypothyroid. And there's other diseases too. There's also drugs that do that. So, opioid narcotic painkillers will, most people know that can also cause constipation, but it also affects this wave. So it slows the migrating motor complex also. So there are all these different ways that, circumstances in life, diseases, drugs, surgeries, things like this that can come in and mess with those protective factors. Another one I didn't mention is proton pump inhibitors, which are meant to reduce acid in the stomach for people who have acid reflux. Such a common medicine, and it has been shown to be a risk factor. That medicine is a risk factor for developing SIBO because it decreases the normal stomach acid, which is one of our protective factors. So there's just all these different ways in which we could get these protective mechanisms to be somewhat damaged or inhibited, and then that would create more of a circumstance where we might develop SIBO.
Well, I have a question for you. Well, I have several, as you can imagine.
I know, and I talk a lot.
Well, it's good, but I really appreciate how you're really taking us through all of this. So would you say that people are having more SIBO now, or is it just that now it's been identified and so we're looking for it? My question, because the reasons that you shared that a person may develop SIBO, is there reason to believe that all of a sudden it's more prevalent now for a certain reason, or is it just that we're giving a name to something people have been struggling with?
I think it might be. I think it might be more prevalent because of things like I think there's more of an increase in food poisoning. I don't know that for a fact, but so many people eat out. And also there's so much international travel. And so maybe I'm wrong. Maybe the incidence of food poisoning hasn't increased, but I feel like the behaviors that allow for food poisoning to occur have increased. And also, narcotic drugs, painkillers that, they were not invented. Well, I mean, sure, there was always opium and poppy, but, at the scale we have them, I think is larger now. I don't think they were available like that before. So once again, as a risk factor, that has increased. And surgeries have increased, I think. And also proton pump inhibitor use has increased. So if these risk factors have increased, it would make sense then that this is increasing the prevalence of SIBO. However, SIBO has always existed. It might have been used, a different term used to describe it, but most everything that affects humans' health now have always existed, but I do think the prevalence has increased.
Mm-hmm. Well, and one of the causes or contributing factors that you mentioned that really piqued my interest is endometriosis. So we spoke a bit about this in my interview with Rebecca, because that was part of her story as well. But I found that to be really interesting. And as you were describing it, I had this kind of visual. So just a little bit of background. I did an interview with, he's a surgeon. His name is Dr. Kyle Biter, and he's a naprotechnology surgeon. And so one of the things that they do is they go in and remove endometriosis. But what was interesting about that interview is because he's a surgeon and he's taken pictures of his surgery, he actually gave me, in the middle of the interview, he pulled up a PowerPoint that basically had all these pictures of endometriosis, so I was able to see it. So as you describe this process of this tissue kind of interfering with your intestines, I feel like I have this image of it in my mind. And so I don't know, would you like to speak a little bit more to that? I've worked with a number of clients who either have confirmed endometriosis or suspect they have endometriosis, and it's so common. And endometriosis is one of the biggest reasons for the diagnosis of unexplained infertility. So I'm just so curious to hear about that relationship between SIBO and endometriosis.
Yeah, I think it's a really common cause of SIBO because, as you say, it is very common. And right now we're thinking there's two main ways it could be doing this, creating SIBO. One is just the swelling of the endometrial tissue itself might be pushing on and obstructing the small intestine, depending upon where that tissue is located for a person. And then the other would be the formation of adhesions from all that inflammation. So, once again, adhesions are basically scar tissue forming in the intestines. They could form inside of the intestinal tube. More likely they're on the outside, somewhere in the abdominal cavity. And they form in response to inflammation and, damage and trauma. So it could be surgery. It could be something like endometrial swelling. It could be an injury into the abdomen area, like a car accident, where the steering wheel goes in there, or what if someone was in a fight, a fall off a bike, things like that. So back to the endometriosis situation, the adhesions can form, and if they form, they're not necessarily obstructing the small intestine, but they could be. Depends on where they're located, how many there are. But they can wrap around the intestine, cinching them, or they could just be attached from one place to another in the abdomen. But the way that where they're stretching is pushing and squishing the small intestine. And, I've learned from Larry Wern, they have I don't know if you know about the Werns, they have a physical therapy, sort of massage-like manual therapy that can remove and reduce adhesions so that you wouldn't have to get surgery. So obviously myself and Rebecca, we're all very, very happy with them for the option for us, Anyway, I've learned from them about, the amount of strength and force that these adhesions have is outrageous. They're very strong, the pressure that they have. So, one of the things that's really interesting to me, what we're just talking about here is a person could have endometriosis and it could then cause SIBO. And so, you can treat the SIBO, but you're really going to need to treat the endometriosis, or the SIBO will just return because it's caused by the endometriosis. But one of the things that's really interesting to me is how the symptoms can be so similar. And it's really important to pick that apart because sometimes I've had some patients where they had both, But all they really cared about was the SIBO diagnosis. This happens to a lot of people. It's sort of an exciting new field, and they just pin their hopes all on this one thing. And sometimes it's hard to get them to pay attention to the other things that are going on, and we usually have more than one thing. And SIBO is always caused by something, so we have to take a look at that. Anyway, one of the differences would be when the pain comes in a sort of a cyclical way. Very many endometriosis patients, will have vomiting and et cetera, from even diarrhea from the severity of the pain. So we do need to take a look at that. In relation to the SIBO. So for instance, if you clear the SIBO, you might get rid of some of the symptoms, but they have a lot of the same symptoms, and you're going to need to deal with that endometriosis.
That's really interesting. And then as you were explaining it as well, I get a sense of where surgeries would be a potential source, because surgeries leave you with scar tissue, potentially adhesions, and then that could also be a contributing factor. So I feel like having that understanding of how this could be kind of a structural issue, I feel like that's very enlightening. I feel like I really have, like I said, like the visual in a sense of what's happening.
Yes, we really think the two main reasons, not all, are that people get SIBO are either structural, as we've just been talking about, some way that there's an obstruction going on, some way. Could be adhesions, could be, like I said, a tumor, could be, there's other things, there's strictures, there's volvulus, there's other things, but structural or motility. And by that, what we really mean is the migrating motor complex in particular is becoming deficient or disordered.
Well, and when it comes to shift to talk a little bit about treating SIBO, so often, I mean, if you did a search on Dr. Google, you could find all about different dietary changes. So I'm interested in a couple of things. So, I mean, we've spoken about the structural and how kind of removing some of those structural issues could actually have a positive effect. But if you had food poisoning that caused an impaired motor peristalsis reaction, so your internal sweep is no longer working, is there anything that you can do that can repair that motor ability, or is it just lost forever if you end up with something that has kind of prevented that from working properly?
Well, theoretically, it shouldn't be lost forever because, it depends on why it's been damaged and how. I suppose if nerves were cut during surgery or something, that's a tougher situation. There are diseases that permanently damage, for instance, systemic sclerosis, also called scleroderma, that essentially turns parts of the intestinal tissue and other parts of the body into scar tissue. It's a different thing than adhesions, but that disease is, at least currently, incurable and progressive. So there are some situations that can occur where you may not be able to get that back. Because you can imagine, how can you do motility if your muscles and everything are turning into scar tissue, basically. But putting that aside, like from the food poisoning perspective, we should be able to get that function back. In particular, oftentimes the cells that have been damaged are called ICCs, ICC nerve cells, and they have very good ability to repair and recover. The problem then is how come we see people that aren't recovering? What is going on there? And, this is a question that needs answering because they should be able to repair. And in the case of food poisoning, we know that what's going on there is there's been an autoimmune trigger and damage. It's a little different than a full-on autoimmune disease, maybe, at least that's the way it's being described now. But we think that what's happening is there is an ongoing autoimmune attack on these cells. And so that's why a person just isn't getting better, is that the autoimmunity hasn't been stopped. Basically, the attack, the damage hasn't been stopped. But theoretically, we should be able to recover that motility. Like I said, it depends on the cause and what's gone wrong. But I will say also that there's a way in which I think the SIBO, I've read in some articles that the SIBO itself, and I can't say how, I don't know how, might be inhibiting some of the motility. I mean, we know that methane can do that. But anyway, putting this aside, so we clear the SIBO, and then because those gases and all that damage is gone, people recover their motility. So that's the scenario for people who can recover rather quickly. The scenario that people that aren't recovering quickly, that are chronic, something else is going on. We either haven't figured out or we don't know how to stop. like that ongoing autoimmune damage or something like scleroderma, something like that.
So the ability to kind of recover and recover that functionality in your small intestine, it really depends on the extent of the damage and the situation, all those different types of things.
Yeah, but I think in the majority cause, there should be hope. We're still trying to figure it out. Dr. Pimentel's the main researcher. He's trying to figure out how to restore that motility function in the ones caused by food poisoning. We don't fully have the answer yet, but we really think we'll get that answer.
Well, maybe you could take us through. Okay, so someone's listening. They've listened up to this point. They've kind of thought about all the different symptoms that we've spoken about and all the different potential causes. And they think, it sounds like this could apply to me. How does one get like an actual diagnosis? And then what are the options to actually treat SIBO and get better?
Sure. So the diagnosis is done by the breath test. And there's two breath tests that will diagnose SIBO. One is glucose and the other is lactulose. There's a problem with the glucose test in that it can only diagnose SIBO in the top 2 to 3 feet of the small intestine. And the reason why is because glucose is absorbed into our body after about 2 or 3 feet. And the way this test works is the glucose or lactulose, these are both sugars, and they're meant to feed the bacteria so that they'll make those gases that only they make, hydrogen and methane. And then that's what we'll be testing for with the breath test. And if we see those gases, then we know that there are bacteria present. And it's the timing of the test that lets us know whether they're in the small or the large intestine. So if we see those gases within the first 2 hours, we know that there's SIBO. If they're in the third hour, it's not SIBO. That's considered to be the large intestine. So anyway, that's the deal with glucose. The one that most people prefer to use is lactulose. And the reason why is because it can diagnose SIBO anywhere within the small intestine. That's the main test we use. And we like a 3-hour test because it lets us assess all these gases better down in the third hour. It really helps us, particularly with the methane and also with hydrogen sulfide, which I haven't talked too much about, but that's a little trickier. So it's the 3-hour lactulose breath test. And anyone wanting more information, what I did all those years ago when I first got into this is I created a free educational website on SIBO with just all this information there for you. So it's called SIBOinfo.com. And you'll notice that there's a heading called resources. And if you go to that and go to testing, I've got labs listed there, not just for the US, but laboratory companies where you can get this test. So that's how we diagnose it. Now, the treatment options there's really four main treatment options. And one is sort of used as an adjunct or supportive, and that's diet. So we've got diet. And the reason diet helps right off the bat is because of what we described earlier. If you can go onto a lower carbohydrate diet, well, then you've got less food for the bacteria to turn into gas. And so that can dramatically help symptoms and quickly, as was my experience. Diet can help right away with symptoms. And I think it also supports in other ways as well. However, the 3 other treatments, which would sort of be the main treatment, would be antimicrobial. And those would be pharmaceutical antibiotics, herbal antibiotics, or something called elemental diet or elemental formula. And I can take you through all of those if you'd like. But basically, we do the antimicrobials for anywhere from 2 weeks to a month, depending upon which one we're choosing, as a single course. And then we usually retest. And we don't have to retest if someone's all the way better. If you're better, that's what we wanted, and then we're good, and we move on to prevention. But if it helped but not enough, which is very often the case, we retest. And we see how well the treatment worked, and that helps guide us for the next treatment choice. And then we move on to that next treatment choice, which is just, again, going to be one of those 3, pharmaceutical antibiotics, herbal antibiotics, or elemental diet. Those are our main antimicrobial options, and we mix and match them as we need to. And what we do is we continue working through treatment rounds with retesting until we get the test to be negative. And then if that test is negative and a person still has symptoms, well, then we know we have to look at the differential diagnosis that we talked about earlier. Basically, something else is causing those symptoms. For instance, in that case I mentioned, we cleared someone's SIBO, but she still had endometriosis. So, of course, she still had symptoms. Now we needed to address that. And there's no reason you can't, if you already know about this, you can't address the endometriosis right away, But anyway, this is how it goes for a lot of people. So what I've just described here is important because there's sort of an overall statistic I want to share, which is that from what we know from studies, about one third of the cases of people who have SIBO can get better after like really one treatment course, either 2 weeks or a month, something like that. And they can institute some preventative measures, but usually they're fine and they don't relapse. And then the majority, 2/3 of cases, are more chronic and require a little more work to get rid of. So there's sort of two components to that. One is they might need more than one round to get that initial case of SIBO, that initial test negative. And the other component is even once they do that, let's say they get that first test negative, or the first course of SIBO gets better, they may relapse at some point. And that could be even fairly soon. And then we have to treat again. Now, what is all this relapsing about? Well, it's because SIBO is caused by something else like endometriosis. And if you didn't get rid of the endometriosis, all the conditions are still present to create the SIBO. So you can clear it, but it's just going to come back. And this is where we get into really, it can become more difficult with SIBO because we have to figure out what is it that's causing the SIBO. And that is not always easy to do. And then second, is there a treatment for it? Something like systemic sclerosis. There's lots of treatment, but there isn't a cure at this point. So in that case, somebody will be a chronic SIBO patient. They're just going to continue to have it, and we're just going to work on managing it, which we can do very well. I've seen a lot of actually systemic sclerosis patients who oftentimes are living better than the people when they first come in with their initial SIBO. So that's the last thing I want to mention, and I'm sure you're going to have a lot of questions, is that when we use the word chronic, it really freaks people out because what people, I think, tend to do is think that chronic means no change in symptoms, or I will always feel as bad as I feel right now forever. And it doesn't mean that. It just means that the underlying circumstance is not cured, but it doesn't mean it can't be very well managed, and you might even be close to symptom free. But, there is a difference between people who still have to deal with something over time and those who don't. And that's where the chronic comes in.
But yeah, it's such an interesting point that you make about chronic because, we're talking about quality of life here. So you mentioned that you basically had a 75% reduction in your own symptoms. And I know in my interview with Rebecca, when we were talking about her experience, I believe that she said she had about an 80% reduction in her symptoms. And that's huge. Like that's the difference between.
That's why I said I got my life back. It's like, oh my God.
Yeah. Well, and one of the topics that comes up in conversations about SIBO and trying to understand it and trying to understand how to get rid of it or how to at least improve the symptoms or get rid of most of the symptoms is, can you address SIBO with diet alone? Or do you need antimicrobials? What are your thoughts on that question?
Well, I think it's okay to do a diet alone if you get the amount of symptom relief that you want. So I would personally, I think 90% is what I shoot for. 90% is like all the way better to me. Now, some people will go for 80%. 80% is good too. Really good. We were just saying that. So look, if you put in diet and your symptoms are to you gone enough to like be like, I'm fine, along with the fact that the diet is, you like it, like it's not too much of a hardship. And it's nutritionally acceptable. Then, if all those things are met, that seems fine to me to do that, to just use diet to manage your situation. Does diet cure it? We have no evidence for that, which was very disappointing to me because, obviously when I started out, diet took my symptoms way down. So I was really, really into it. And also the specific carbohydrate diet, the one that I used, has a lot of language in there about curing. And the situation there is that diet was created for a pediatric celiac disease. How celiac was known at the time, really from our looking back, we think it was actually pediatric Crohn's disease that it was really created for. And so those children were actually able to become cured. So the diet was quite specific to a certain population set. And so unfortunately the language is now spread out to these other conditions that it's used for. That's made a lot of people think that the diet can cure it. And I just have never observed that in my practice. Now, if it has, then that's really good, and I'm thrilled. But so what? How do we really care if it's curing it if you alter your diet and the diet is not that restrictive and you're happy, it's nutritionally sound, and your symptoms are gone? Like, then what do we care? The only reason we'd really care if it, quote unquote, cured it is if the SIBO is creating another medical circumstance that we need to care about, like anemia or leaky gut. Because leaky gut if somebody has leaky gut, they're more likely to get an autoimmune condition, and they come in pairs, so we may care about that. And then we may want to actually go after getting rid of the bacteria. But I think the super important thing here too is, well, what's the underlying cause of the SIBO? Like, is there endometriosis? Is there, let's see if we can figure out what it is and get rid of it. But anyway, back to that original question. So now let's just see what happens for so many people that I see is that the reason that they were actually coming to me is that they tried diet, and what would happen is, yes, it would help their symptoms very much, but they were very unhappy with the diet that they needed to do, and they would customize it to themselves. Everybody has to figure out exactly what foods they can and can't have, even within all the SIBO diets. Anyway, they would find that they were more restricted than they wanted to be. They wanted to have some leeway. There were certain foods they wanted that when they would eat, they would have symptoms, and they wanted to eat those foods. So people would come to me in that situation saying, I don't want to just use diet. Like, this stinks, so, can you help me? And that's really why we do kind of one of the main reasons we do the antimicrobial treatment is to allow a broader diet, to allow for less restrictions. And so then we would do that, and we would see that happen. So I think so much of it just depends on what you're wanting and where you're at and what's happening for you. Is, how good is the diet working? And the people that I would be seeing, had usually gone through all the diets over years, tweaking, and they just were frustrated. It's like, it's time to do something else. And then there are other people that are never going to be willing to use diet barely at all, and so they're going to choose antimicrobial treatment. So I try and respect where someone else is at and what their wishes are. But as to the actual question, can we use it alone? We sure can, based on what we're wanting and how well it's suiting to us. Does it actually cure it? I don't think we have evidence for that, but I would like there to be.
Be nice if there was. Well, I have two final questions for you. One is, in our pre-chat, we spoke just a little bit about some of the results your colleagues have seen in the area of fertility, specifically with regards to SIBO and, how that changes when the infection itself, if that's what we're calling it. Yeah, infection, or what's the word I'm looking for?
Oh, like just maybe.
Yeah, but overgrowth.
Yeah,
I felt like infection wasn't the right way to say it.
I know, it's not quite right. Yeah, it's close, quite right.
But when the overgrowth is cleared, some of the results that some of your colleagues have found in that realm, when women are actually trying to conceive and find that they have a SIBO diagnosis.
Yeah, so I've got some colleagues who focus on fertility and SIBO, in fact. Two of them that sort of work together. And one focuses on SIBO, the other on fertility. And so when she's working through, one of these colleagues working through the fertility, what she can do to help fertility, what she'll often do is screen them for SIBO, see if they have it. And if they do, she'll send them to the other colleague who will treat it and deal with it. And they have, multiple cases now where that seems to have been the crux. They got rid of the SIBO, and then fertility was restored and the woman got pregnant. So, I don't know all the mechanisms here, and, to describe it, I just hear of their success with this link, and I think it's wonderful, so it's something just to be considered is, if you're having issues with fertility, maybe get a SIBO test and see if it's there. And I would say, this wouldn't be probably the first thing you'd do, obviously. But if you've had some trouble and you're not getting places, then consider looking at it, and it may help.
Well, and, we've spoken a lot about SIBO, and I really appreciate you taking us through. I feel like you really painted a picture for us to gain a better understanding of, how this is working in the body and how it can affect us in different ways and what causes it. I feel like I really appreciate you taking the time and just the care to explain it to us. So from everything we talked about today, what is one thing that you want the listeners to take away from our conversation?
I think it would be to know that there's something that can be done. Like if you are a person having these symptoms, maybe you've been told you have IBS, there's options, and you can feel better, I would imagine. I mean, pretty much everybody that I've ever seen or talked to with SIBO, we can make improvement. even in the most toughest cases. And then there's cases that are easy. So I just want people to know that there's something that can be done and there's hope, and they can feel better.
Oh, well, I think those are wonderful words to end on. Dr. Siebecker, thank you so much for being here today. It was just a wonderful conversation. I'm really excited to share our interview with our listeners.
Thank you so much for having me.
Well, and I know you mentioned there's a few things. So for the listeners who are intrigued by the topic of SIBO, or if you're looking for more information, Dr. Siebecker, I'd love for you to share with us some of the events that you were telling me about, and also where our listeners can get in touch with you and learn more about SIBO if they're curious.
Oh, absolutely. So my website is SIBO, SIBO, info.com. And that's just a free educational website where you can find more about all of this. And I always post events and things there. But what we've got coming up is October 21st through 29th. We've got an online SIBO summit. Those are like the health summits where we offer a lot of free interviews over a week's course. So that will be happening. And if this interview is posted afterwards, I believe that it will still be available. Usually the people who put these summits on make them so you can partake even afterwards. And then I'll be doing a course. I'm not sure the exact title, but I think we're calling it something like the Roadmap course. And the summit host, who's a SIBO patient, asked if I would do this class, basically taking patients through what they need to do and think about step by step when they have SIBO, sort of the journey of treatment, what they need to think about and what comes next. So we'll be putting that Roadmap course on in November. And other than that, I would say if you're interested in this topic, you could sign up for my newsletter on the welcome page of my website. I only send it usually about 4 times a year, just quarterly, with news and updates about SIBO, new information, new resources, things like that.
Mm-hmm. Well, thank you so much for sharing that with us. So what I'll do is I'll be in touch with you, and we'll get the links to the summit, the roadmap, and of course your website and everything. And we'll put that in the show notes page so that the listeners on the go don't have to worry about trying to write it all down right now.
Excellent.
All right. Well, thank you so much for being here. It's been such a pleasure having the opportunity to chat with you today.
Thanks so much.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/167. I hope that you enjoyed my interview with Dr. Siebecker. It was such a treat to be able to talk with her. And one of the things I really appreciated about our interview was how she really shared the different factors that can contribute to SIBO. I think what I found the most interesting were the structural implications. So the fact that if you have surgery that causes scar tissue or adhesions, or if you have endometriosis and that causes adhesions and different physical changes to your body, that can actually contribute to SIBO. I think that's very, very interesting, because up until that point, I think I thought, always with regards to food. So because of the symptoms that you can experience with regards to your digestion and the relationship between SIBO and IBS, I often thought that it was, food related or food poisoning. So it's interesting to hear that there's also this structural connection to this illness. And it makes sense then, if you think about all the different reasons that could contribute to getting it, it makes sense why so many people are struggling with it and why it's so common. And it also ties into the interview that I released with Rebecca, which I'll link to in the show notes for this episode, where she shares her own story of, SIBO and endometriosis and how, they very commonly go together. I feel that this interview with Dr. Siebecker really shed some light on why there's that comorbidity there, why they may be related to each other, because in fact, endometriosis could be a contributing factor to your likelihood of getting SIBO. So I hope that you enjoyed this episode. One of the reasons that I chose to do, you could think of it as a little mini series on SIBO, since I'm sharing these episodes back to back on the same topic, is just because I've worked with a number of clients who've struggled with different gut issues, different challenges, different IBS symptoms, SIBO diagnoses, or, potential SIBO based on the symptoms. And so it's one of those areas that I wanted to explore on the podcast, because there is this relationship between gut issues and fertility challenges. And so it's interesting, Dr. Siebecker shared some of the success her colleagues have had, and that reminded me of the interview that I recorded with Dr. Kalish, which I'll link to in the show notes, where he spoke about his systematic approach to supporting women with fertility challenges. And one of the aspects of his approach is to screen for any gut issues and resolve any gut infections or any gut issues that arise. It's been his experience as well, as he shared in our interview, that for women who are struggling with fertility challenges, you want to look in these areas and see, could this be a factor? So I feel like it's just more information to give you a sense of empowerment, a sense of at least you have something to go on, and different areas to rule out. I think that that's important as well when you're trying to figure out what's wrong. It may not be SIBO. It's easy to focus on one particular aspect or one particular illness and see SIBO everywhere, but it's important to know that it could be a factor. And I'm very fascinated with by the relationship between SIBO and IBS and how Dr. Siebecker described that. So yeah, I hope you enjoyed this interview, because I know I definitely enjoyed having this great conversation with Dr. Siebecker. So as we bring our episode to a close today, make sure to head over to fertilityfriday.com/group program for more information about the 10-week Fertility Awareness Mastery group program that's starting in January. And of course, I want to thank you for spending some time with me today, for taking me for a walk or to the gym, if you're commuting to work or going on a road trip. Whatever you're doing, I really appreciate you taking the time out of your day and supporting the show. There's so many podcasts you could be listening to, but you're listening to mine, and I really appreciate that. And I also appreciate all of you for sharing the show with your friends and talking about it, and just generally sharing the information with other women. I really feel like that's kind of the grassroots way of spreading this information from one woman to another. And so I really appreciate you for being part of that. And so thanks again. And as always, until next time, be well and happy charting.